that's not the worst of it, believe it or not. It's the people, because there's less money going into certain hospitals, physician groups, nursing homes, other places that depend on Medicaid. Those hospitals now will either need to find that money somewhere. And so they will need to cut costs in order to um, keep their costs down. And so that means they need to start getting rid of certain services.
So they're going to get rid of services that really benefit people, I would imagine, the ones that maybe provide rides for people that can't get there, or preventative care, or something to prevent people from getting sick. I would bet those would be some of the first things to be cut.
Some of the first things to be cut, exactly, are those that are really helping people get to the hospital, helping people in the parts of their care that's outside of the immediate, what we think of as care, as a doctor touching a patient. Not only that, but it's just basic services like security. Hospitals, and there are hospitals in our district and throughout Indiana 9, especially in rural areas, that do not have security guards. And what that means, if someone comes into the emergency department with a gun, if someone has a behavioral emergency, meaning someone is, on drugs, yes, but also just sick and therefore delirious and lost
Right.
control, or having a psychiatric emergency
Older people with UTIs, that really affects their mental health. They're
of,
sweet
of
people, but they're
all the
not
time.
thinking straight. Yeah.
And so, if it's dangerous to a nurse or someone to have to deal with that patient, now you're calling 911 to get the cops and the police over to the hospital to take care of that, taking those police away from something that who knows that they should be doing otherwise, right? And so that is an enormous problem. Exists today, and I'll put it on the line. Hospital in North Vernon and Jennings County um, does not have security today.